We all understand the importance of mental health, yet most Canadians don't seek the support they need. Our leading digital innovations drive better outcomes for employers and employees by helping employees navigate what mental health care is available to them and find the solutions they need to get back to feeling their best faster. We also have a team of organizational health consultants who can work alongside you every step of the way. Learn more about Sun Life's commitment to mental health.
Despite the obvious issues and tragic consequences associated with the pandemic, employers responding to our survey also listed a variety of positive impacts, including higher productivity, as Mario mentioned, increased flexibility, more time for family, strengthened mental health programs, and increased awareness of mental health issues, and more. I'll direct this to you, Michael. Can you comment on the positive impact the pandemic may have had on specific areas of the workplace? What will be COVID-19's lasting effect on the world of work?
I think that the pandemic has proven that people can work from home. I'm along the same line of Mario. Mario said at one point, I think that he was not a big fan of people working from home, and I wouldn't have been either back in the day. But I can speak from this personally. In March of 2020, I was in full panic mode. We'd come out of our slow season, and we knew that we were being locked down and shut down. For me, taking on this role of advocacy and whatever roles people have taken on gave me drive, focus, ambition. And so, for me personally, the pandemic helped solve the crisis that I was going through in mid-March, end of March. And I think that it gave people an opportunity to reinvent themselves. It gave people an opportunity to reinvent their business, to hear from their staff. I remember when we laid everybody off, 23 people, we were all in the warehouse and we laid everybody off. And every single one of the staff came up to my former business partner and I, and they said, "You guys saved the business. We'll be right here waiting to come back." And so, the staff got involved and they wanted to be there. They came out, they volunteered when there was an opportunity to do something to keep the business afloat. So I think we saw the best in people come forward. And I think that's a really great thing.
Well, actually, Michael, I think that's a great story. It almost made me emotional that your employees were willing to do what they could. And there are 1,000 more stories like that. It was quite amazing how people came together, and the staff and the owners would kind of try to work and do what they could to kind of keep the business afloat. But I also think some of the positive stuff that came out of it, despite some of those good feelings, is also something else Michael touched on, which is it's fast-tracked a lot of businesses to think about what else can they do, right? How else can they sort of broaden their business to sort of keep some sort of revenue coming in? So we saw, for example, obviously a lot more restaurants doing takeout or creating frozen food versions of what it is that they made. We saw, of course, a lot of businesses that have face-to-face interaction with clients go onto videos, right, which had never really been done before. And I think some of that is all going to stay. I don't think that's going to disappear. I think we saw a fast track of these sort of new ways of doing business in so many different sectors of the economy that I think is a good thing. I mean, the fact that you can do a video with your doctor or with your physiotherapist, whatever, doesn't mean you have to go in anymore. You could actually, it made things more accessible. It broadened the product lines of other companies as well, right? So definitely, I think it's created, from a business perspective, new opportunities. And I think also, the subject here today is mental health. I think it also helped broaden the understanding of what we need to do to help people through a pretty stressful time. When you have basically millions of people going through it at the same time, suddenly it becomes a much more important issue to tackle. And I think hopefully going forward, that momentum will continue and we can continue to have programs that will be of use for, whether it's an employee, an individual, an employer, available for them should they need.